Hi, I'm Dr. Ralph Weiche, and I am the EMS Medical Director for Whatcom County, and I wanted to talk about how I want you to do a BEFAST exam looking for a stroke. So the B in BEFAST stands for balance, and what I want you to do, if you can, is I want you to try to stand these people. I want you to try to get them on their feet and have them walk over to your gurney if they can. And what you're looking for is you're looking not only for weakness in one leg as they try to stand, but you're also looking to see if they are off balance and if they need to steady themselves when they walk. You can also test it by trying to do heel to toe walking, where they walk with heel to toe. Most people won't be able to do that. Another way to assess that is when they're either sitting up or standing. If they have their arms out and their eyes closed, you may notice that they sway and can't keep themselves upright. So that's the B, that's the balance part of it. So the E is the I part. And there's two things I want you to check on the I part. One is if it's a bad stroke, a big stroke, you'll notice that they have gaze deviations, so their eyes will preferentially go off to the side. Short of a gaze deviation, I want you to have them follow your finger in front of their face and look to see if their eyes can go all the way to the left and all the way to the right. If they've had a stroke, one thing you might notice is that they have neglected one part of the field of vision, so they're unable to follow all the way over to that side. Another way to challenge this is to have them look at your nose, and while they're looking at their nose, put your hands out on their peripheral vision and ask them if they can see you wiggling your fingers on either side, and they'll either do one of two things. They'll say yes or no, or what you'll notice is you'll wiggle here and they say yes, and then you say, can you see me over here? And they won't answer you. They'll turn their head because they can't see out of that side of their vision. So that's the I part of it that I want you to do. The F part is the face. And so what you're looking for there is you're looking for asymmetry in the face. So you're looking for that facial droop. You're looking to see if this corner of the mouth droops down. One of the more sensitive findings is loss of the nasolabial fold. So that's this little crease that we both have on one side. So if you've had a stroke on one side of your face, that will look flat. You'll actually lose that fold, and you might have your face droop. One of the ways you can assess for that too is ask them to smile or show them your teeth, and you'll see one end goes up, but the affected side doesn't go up. So that is the F part of BEFAST. And the A part is the arms. So what I want you to do on the arms part is I want you to have them put their arms out in front of them, hands out, palms facing up, and fingers spread apart. And you're going to have to remind them to do this because they're going to want to go like this, but that won't give you a good test. You really have to force them to extend at the elbows, really rotate, and spread their fingers apart. And the reason why you want them to do that is this pronator drift is one of the more sensitive findings for weakness in the arm. So you'll have them in that position, ask them to close their eyes, and then just wait for a moment and watch to see if one arm rotates in and starts to fall. That can be the most subtle finding for arm weakness. So that's what I want you to do with the arm part of it. And then the S part of it is the speech, and you're familiar with the slurred speech of a stroke. So there's several different ways where speech can be altered. Probably what you're most familiar with is the slurred speech, where they're trying to say their words and it just comes out slurred. Other ways that it can present is with a Broca's aphasia, where they know what they want to say, but they can't quite get the words out. And you can ask them and say, you know what you want to say, but you just can't get the words out, and they'll say, yeah, it's like that. Another way that is less common is something called a Wernicke's aphasia, and that is a word salad, where they'll be saying a bunch of words, but it's all a word salad. It doesn't make any sense, and the context is wrong. That is a less common type of aphasia that you can see with stroke. And the last part of it, the T, is the timing part of it. And as we've talked about before, a acute stroke is probably one of the most time-sensitive things that you do, where millions of neurons are lost every minute. And if you have a code stroke, which is within the potential for giving them a thrombolytic within 4.5 hours of onset, they need to come in right away. And we've also talked about previously about our stroke standbys and our wake-up strokes. So watch that video for details on that. Okay, well, I hope that's clear to you. If you have any questions, of course, you can always reach out to me, but I appreciate what you guys do, and someday you'll save a life, so train and prepare for that day. Thank you.